Former Grand Slam tennis champ Monica Seles announcing that she had recently been diagnosed with a rare neuromuscular disorder. Here to explain the condition and what symptoms to look out for is Dr. Faktorovich, the director of neuromuscular medicine with Marcus Neuroscience Institute, which is part of Baptist Health South Florida. Doctor, thanks so much for being here with us. So what disorder are we talking about here?
So myasthenia gravis is an autoimmune disorder, which includes basically your immune system attacking the connection between the muscles and the nerves. So you can imagine, so say for example, you're trying to make a fist, right? So a signal has to travel through your arm, through the nerve into the muscle. And myasthenia gravis attacks the ability for the nerve to activate that muscle. And what that does is it causes muscle weakness that worsens the more somebody uses those muscles and improves with rest.
Is this just a random disorder, or are certain people at risk for it?
Well, it's an autoimmune disease. So anybody who has a history of other autoimmune diseases will be at increased risk of myasthenia gravis. Most commonly, I would say it occurs in women under the age of 40 and men over the age of 60, but really it could affect anybody at any age.
What are some of the signs and symptoms to look out for?
Well, some people have a mild form of myasthenia gravis that really only affects the eyes, and that causes drooping of the eyelids, double vision. Other people have a more severe form that can cause weakness of the arms, the legs, difficulty holding their head up, difficulty swallowing, difficulty breathing. And really when it affects swallowing and breathing is when we become concerned about it it becomes more dangerous and more life-threatening. And at that point, a lot of times people either need emergent treatment or admission to the hospital.
What does this look like for someone? Can they live a normal, healthy life? Is there a treatment, cure?
Yeah, so the disease tends to be the most severe within the first 2 years of diagnosis. And even somebody that starts out with very mild symptoms only affecting the eyes, oftentimes within the first year, can spread to involve the rest of the body. However, if people are diagnosed quickly and treated early, they can actually live very, very normal, full lives. Everybody's a little bit different, but there's a lot of really amazing emerging treatments. Over the past, let's say 5 to 10 years, a number of really specific disease treatments have come out that are both very effective, and now we can even counsel patients on choosing treatments that fit their lifestyle more, including the route of administration and how often they receive treatments.
What do some of those treatments look like?
Well, some of them are infusions. You have to go to an infusion center, either every couple of weeks or sometimes even every couple of months. Sometimes it could be done at home. Other people can inject themselves. Historically, we didn't really have a lot of disease-specific treatments to treat myasthenia gravis, but now we do. So it's actually a really exciting time to be treating this disease.
How many people does this impact?
So it's estimated to affect about 3 out of every 100,000 people, but I would say that's probably an underestimation because people oftentimes live with this disease for quite a while before they receive an accurate diagnosis. And so there's definitely more than that out there. And in my clinic, it's actually very common because I specialize in this disease.
Right, of course. Is there anything that we can do or people can do to lower their risk?
So unfortunately, nothing has been shown to lower the risk of myasthenia gravis. So there's no lifestyle factors that lower the risk. Sometimes certain medications, having surgery, or environmental stressors or systemic stressors can unmask the disease, but it doesn't cause the disease. And so the focus is really on knowing the signs and symptoms, catching it early, getting started on treatment, rather than prevention.
All right, doctor, thank you so much for being here with us today.
Thank you so much.
If you want to learn more or to watch this interview, you can head to our website, WPBF.com, or download our free WPBF 25 News app.